Lower high blood pressure, naturally 3 things for immediate relief. In this video, I'll show you 3 ways to reduce your blood pressure naturally without medication. And I'll share with you an absolute turbo tip that has worked really, really well. In the clinic where I worked, we used it very, very often. So much so that for many people, we were able to discontinue their blood pressure medication after just the 3rd or 4th day of this measure. And that's for good. Am I against blood pressure medication? No, not at all. Unfortunately, it's just prescribed way too early and too quickly. It's certainly an effective way to initially get blood pressure under control. Of course, it's also very, very important in emergency services to ensure blood pressure is controlled, because the risk of a vessel bursting is definitely there if we let blood pressure rise too high for too long. So, if your doctor prescribes blood pressure medication at first, sure, take it if your blood pressure is too high, but you should have the long-term goal of eventually discontinuing the medication. My father, unfortunately, fell into this trap. What happened? He ran out of his blood pressure medication, so he had high blood pressure and let it slide for about 4 to 5 weeks, and God forbid, he ended up having a stroke. So don't make this mistake. The medications are sensible at the start, but we should think step by step about why the high blood pressure occurred and how we can get off the blood pressure meds, because you know it, it's a clear case. You go to the doctor, you show up, the doctor says your blood pressure is too high, and you get a 24-hour blood pressure monitoring. You go through the whole diagnostic process and go home with a prescription, and that's not necessary. Unfortunately, there are many opinions on how to manage blood pressure without medication. Sadly, many of these opinions lack supported data. In this video, I'll also show you scientific approaches that are used in many medical practices, or even back in the clinic where I worked, where we could quickly get blood pressure under control with these measures and then wean off the blood pressure medication, but we'll get to that later. What's the most important thing? First off, 70% is lifestyle. And I always tell my patients this, 70% lifestyle and then 30% medication. So if you have high blood pressure and you're breaking certain rules, let's say in your lifestyle, then you could take 10 blood pressure medications and it still won't do any good. The key is that you first need to make changes in your lifestyle, and ultimately that's what we want to talk about. Let's take a quick look at the blood pressure issue. In Germany, blood pressure remains the #1 risk factor for cardiovascular diseases. And cardiovascular diseases are the leading cause of death. Responsible, that's the issue. We have many people between the ages of 70 and 80 who are affected, who suffer from high blood pressure, where the problem really becomes apparent. We have about 20 to 30 million citizens in the country dealing with this, and unfortunately, roughly a third are unaware of this condition, and often it's just that they experience headaches for an extended period or various symptoms or maybe even vision problems, dizziness and so on, and then they finally go to the doctor who says, gee, you must have high blood pressure or hypertension that's been there for a while, and many people then just go home with their blood pressure medication, and we could really help them, 3/4 of those treated, achieve good blood pressure levels with therapy. Of course, we want to increase that so that everyone, let's say over 80%, can have good blood pressure levels again. But many people, well, they don't stick to the lifestyle changes as closely as they should. High blood pressure is also a problem for the global population. About 1/4 of the world's population has high blood pressure. It cuts across all social strata and countries. So there are no major differences. What can we do then? Let's take a close look at the 3 measures. The first step is certainly altering your diet or shedding some pounds. It's important to prioritize a specific diet in this case. So we're not talking about any crash diets or anything like that, but rather it's about positively changing your diet, and I'm talking about the so-called DASH diet. And DASH stands for Dietary Approach to Stop Hypertension, which is essentially a dietary change aimed at lowering high blood pressure. It's very similar to the Mediterranean diet, which I always recommend, and studies have shown that a Mediterranean style of eating with lots of legumes, lentils, beans, vegetables, fruit and whole grains is beneficial. Olive oil, fish, omega-3 fatty acids, it's just very, very good for our health. This diet, the Mediterranean diet, essentially beats everything. The DASH diet is quite similar, but there's an additional factor at play, and that's where the salt content comes into play. That means it's a low sodium diet, this DASH diet, and in this combination it works quite well for blood pressure. It's just as effective if you lose weight, because we know for every 22 pounds of weight loss we see about a 15 millimeters of mercury improvement in systolic blood pressure. So that's about 1.5 millimeters of mercury per kilogram. I can confirm this, and this is the quick trick I want to show you. So if you want to quickly get your blood pressure under control, fasting is an option. I was a doctor at a fasting clinic practicing Buchinger therapeutic fasting, and we carried it out with great success. However, I must emphasize that if you suffer from high blood pressure and want to fast, you must do so under medical supervision. Why? Because you can't just continue taking your blood pressure medication. The effect is so rapid that you might be able to have your medication by the first, second, or third day, or in the best case, even stop taking it altogether. I've had patients who by the third or fourth day we were able to take off their medication and they never needed it again. Why? Because they then transitioned into a DASH diet, a dietary change in the sense of managing high blood pressure. Interestingly, the data show us that it doesn't matter how fast or slow they lose weight. So they don't need to crash diet or take such extreme measures as fasting. If they gradually lose weight with high blood pressure, it will certainly have its effects, its positive effects, so it will work. What else comes to mind with nutrition? They can rely on existing dietary concepts like metabolic balance or the Logi diet, or liver fasting if they also have fatty liver, or as mentioned, Buchinger fasting, or even the mild elimination diet. All those relief measures truly benefit the body in that situation, providing much needed support. It's important, as I've said before, to reiterate that discontinuing blood pressure medication should be done under medical supervision, because if someone has high blood pressure and is on medication, they may also have other comorbidities. The second measure, which we've just touched on, is the so-called low sodium diet. And here there are different recommendations on how much salt is allowed per day. And as often happens, there's always someone who takes it too far. You've been a vegetarian since 1987 and have been avoiding salt since 1989. How can food taste good without salt? Don't worry, you don't have to give up salt entirely. I personally think it's not healthy what Mr. Lauterbach is doing here, because you can also end up with a sodium deficiency if you eat too little salt. The main symptoms there are nausea, mental confusion, or even loss of appetite. And if we look at the professional societies, there's the American Heart Association, for example. They say we should consume 1.5 grams of sodium per day if we have high blood pressure. To put that in perspective, 100 grams of Gelbwurst contains 0.7 grams of sodium, 100 grams of Emmental cheese has 0.3 grams of sodium, and 4 slices of bread, which is about a day's worth of bread for us, contain 0.5 grams of sodium. So this is a very, very tight calculation. By the way, we have to multiply the sodium content by 2.5 to get the salt content. So 1 gram of sodium would then be 2.5 grams of salt, and vice versa. You always have to pay attention to this. The problem is quite simple. If we look at the daily requirement from bread alone, we'd already have 1.25 grams of salt. And in my opinion, this recommendation from the American Heart Association is set much too low. They themselves write in their recommendations that at 2.3 grams of sodium per day, or about 6 grams of salt, if you go below that, not much else happens. They do see that blood pressure improves a bit more, but not as dramatically. Therefore, I would say that these just under 6 grams of salt per day are perfectly fine. And the data is very, very strong that with a low salt diet, not a salt-free diet, but a low salt diet, the blood pressure can regulate itself very well. Many people think that if they eat other types of salt, like Himalayan salt or sea salt or some special mountain salt, there are big differences. I just wanted to clarify that this is not the case. There are minimal differences, but these differences are ultimately not significant. There are other differences in these types of salt in terms of other minerals, but not when it comes to sodium. So the question is, what benefits can come from following a low sodium diet? Well, research indicates that by monitoring your salt intake, you may reduce the need for 1 to 2 blood pressure medications. Let's focus on salt for a moment, as sodium's counterpart in the body is potassium. Insufficient potassium levels can also contribute to elevated blood pressure, highlighting the importance of maintaining a balance between these two minerals. Potassium and sodium need to be in balance with each other, and if you eat foods high in potassium, you're essentially tipping the scales towards a positive balance, especially if you have high blood pressure. Unless, of course, you have a kidney condition and your doctor has told you to avoid potassium or foods rich in it, then you obviously shouldn't. Foods rich in potassium, and it's starting to dawn on us again, include legumes, bananas, whole grains, and so on, vegetables. So this seems to be a big reason why the Mediterranean diet or the DASH diet works, because they include many foods that boost your potassium levels. You should also consider cutting back on your alcohol consumption. Recent studies on blood pressure recommend that men limit themselves to a maximum of 2 glasses of wine or 2 beers per day. For men, it's up to 2 glasses of wine or 2 beers, and for women, 1 glass of wine or 1 beer. No more, please, and certainly less at any time. Of course, you should quit smoking. Nicotine has to go, and you definitely need to reduce your stress, as there are very clear connections with high blood pressure. Transitioning to the third measure, which can yield immediate results, involves physical activity. Encouragingly, there's positive news in this regard. While some may not relish exercise, the target is to engage in moderate outdoor activities such as a leisurely stroll, brisk walking, Nordic walking, or even light jogging. Around 150 minutes weekly is recommended. Naturally, exceeding this amount is always an option, as long as it doesn't become stressful, but the 150 minutes are a given. And what's also allowed, and I find this very, very interesting, is what's called resistance training. That means if you train with bands, for example, or light weights and so on, it can also be very effective in lowering blood pressure or having very, very positive effects. And here we're talking about twice a week, 2 to 3 times a week for about 20 to 30 minutes. Of course, it's best to combine this with some light cardio training outdoors and then occasionally some strength training. Why? As we age, we know it, we lose our muscles, we need to exercise more, put in more effort to maintain our muscle mass, and it's very, very healthy to enter old age with a good or large muscle mass. And I have one more bonus tip for you, and this is about gut health, because there's data showing that people with high blood pressure, when they get their gut flora back in balance, they can experience a blood pressure lowering effect. And how can we explain this? When the gut flora is off kilter, when your bacteria are no longer perfectly balanced, then so-called putrefactive germs proliferate, and these putrefactive germs produce certain substances. These substances are called biogenic amines, and these biogenic amines can essentially affect your blood vessels. They have the ability to adjust the diameter of your blood vessels, leading to either constriction or dilation, which can unfortunately raise blood pressure. This phenomenon was scrutinized in a 2014 meta-analysis, revealing that individuals who ingested probiotics, beneficial gut bacteria, encountered a reduction in blood pressure. This comprehensive analysis encompassed 9 studies involving close to 550 participants. Upon thorough examination, it was noted that individuals with elevated blood pressure saw positive effects from probiotics. Conversely, those with normal or low blood pressure did not experience a notable decrease with probiotics. On average, they witnessed a reduction of around 4 to 5 points in systolic pressure by regulating their gut microbiota. This was the typical outcome. In instances where individuals had significant issues with harmful gut bacteria, a more pronounced impact was observed. This could potentially result in a significant decrease in systolic pressure by 10, 15, or even 20 millimeters of mercury, as the harmful elements affecting blood pressure were eradicated from the gut microbiome. However, this effect is not immediate. It usually takes about 2 to 3 months to adequately restore the gut flora before such benefits manifest. So, in this particular situation, patience is key, unlike with fasting, for instance. There's also a very recent study from 2013 that delved into this topic, where certain microbes from breast milk were introduced. These microbes were then administered to mice with high blood pressure, and it was noted that they were highly effective. Further research revealed that these probiotics actually interact with metabolism, influencing the regulation of blood vessels. Ultimately, the smooth muscle, the contraction, has been harmonized once more, simplifying the explanation. I trust these suggestions have been of assistance to you. Remember, seek professional help if you're on medication or have high blood pressure. Give the DASH diet a shot or consider a more streamlined and faster weight loss program. I'd be grateful if you shared this video with your loved ones to keep them informed. Stay tuned for the next video. Until then, take care, stay healthy, and I eagerly anticipate our next meeting. Thanks for listening and see you soon.